I'll be your nurse today. Can I have your name and date of birth? Rachel Overton. All right, and your date of birth? 10/1/94. Perfect. Do you have any allergies? Any allergies to medication, iodine, latex? No allergies? Perfect. I'm gonna wash my hands. So, the doctor had ordered for a Foley insertion on you. Do you have any questions? All right, so I'm gonna check the order in your chart, double check it, check the order in the chart. So I'm gonna wash my hands again, and so I'm gonna prepare you for your Foley insertion, okay? Do you have any questions? Are you in any pain? No pain? Perfect. So I'm just gonna position you and get you ready. I will perform pericare before inserting. Pericare was already done. Get you back. I'm gonna raise you up to my level. All right. Just let me know during the procedure if you have any pain. I will provide privacy for my patient by pulling the curtain. All right. All right, so you're all positioned. Privacy was provided by closing the curtain. I'm gonna wash my hands again. Pericare was already performed. I'm gonna check my order in the chart again just to make sure I have the correct patient and the correct order for the Foley insertion. Identify my patient and allergies. Now I'm gonna open up my sterile kit. First flap opening away from me. All right. Okay. So now that it's open, I'm gonna grab my drape. Reach over. I want to make sure I don't turn my back on my sterile field. Make sure I don't reach over it. I have a 1-inch border. Make sure that is shiny side down. Drop it. Once that is done, I'm going to grab my sterile gloves. Grab my sterile gloves, come out and around, come over without crossing my sterile field. All right, now I'm going to put my sterile gloves on. And if I don't get my sterile gloves on the right way first, that is fine, because once I have both sterile gloves on, I will be able to fix my gloves. And I'm going to pull my gloves down as far as it'll let me, because I'm as sterile as my gloves go down. So once I got my gloves on, I don't want to go below my waist. I want to maintain sterile field by not crossing over my field and keeping in mind my 1-inch border. So I'm gonna get my tray set up. We're gonna put some iodine on our gauze. Come back out and around, drop it, throw it away, come back. We are gonna put some lubricant in our kit for our Foley, so it's lubricated. Drop it, come back out and around, making sure I don't go below my waist, cross my sterile field. Now I'm gonna come back, grab my saline syringe. I'm gonna hook it onto my catheter. All right, once that is done, I'm gonna place it back in my tray. I'm gonna take the plastic off of my Foley. Being very careful, maintaining sterile field, not crossing over, keeping in mind my 1-inch border. All right, once we got the catheter out, I'm gonna pick up my tray, stick the Foley in the lubricant, put that back down there, place my tray down, and turn around. I am maintaining sterile field, come back out and around, toss it, keeping above waist. All right, now I'm gonna pick my tray up and come over to my patient. All right, drop it. All right, so this is my dirty hand, this is my clean hand. All right, Rachel, so I'm gonna start the process of inserting your Foley. I'm just gonna come down here and spread apart your labia, and I'm going to clean, okay? Might be a little cold. So I'm gonna grab my cotton swab, and I'm gonna clean the outer. I'm gonna clean first away from me first. So going down, out, and around. Drop my cotton swab, come back out and around, grab it, grab my other cotton swab, come back, clean down closest to me, come back out and around, drop it, come back, grab a cotton swab again, and I'm going to come over and clean down the middle, come back out and around, drop it, some don't, they drop it in the garbage, come back, grab my tray, come back out and around, drop it, come back. All right, so I'm gonna insert your Foley. I'm gonna have you breathe in. So take a big breath deep in for me. I'm gonna turn my tray around, which I can't because I am still sterile, maintaining sterile fill, and my tray is still on the sterile drape below. And I'm just gonna grab my catheter, get this up so it's easier for me. All right, take a deep breath in. I'm going to insert the catheter. I have urine flow back. I am going to insert 2 more inches. All right, I'm going to inflate my balloon. Inflate my balloon. I'm still maintaining sterile fill because my gloves are covering me and I'm not reaching over. Once I do that, I can take my syringe off. I'm just gonna pull back until I get a tug. Once I feel a tug, at this time, if I want to get a urine sample, I could get it from the bag since the bag is sterile. All right, Rachel, so your Foley is in. I'm just going to attach the bag to your leg. Attach it to your leg. And then set this over to the side because I want to hang that bag lower than you. The bag needs to be lower than you, okay? Take this out. Clean up my mess. I would perform Pericure again for my patient to clean up any mess. Once I do that, take my gloves off. Pericure was performed. Get my patient back in a comfortable position. You feeling okay? No pain? Perfect. I'm just gonna make sure that your back is lower than you. I'm gonna come around that side. Make sure the back is lower. All right, I'm gonna get you back comfortable. Lower the bag down. I'll give you your call light. You let me know if you need anything, okay? I will wash my hands again. I will document the procedure, how well it went, the size of the Foley, how the patient tolerated it, the color, the odor, if the urine was cloudy. I would document what the urine looked like, how much came out at one time. Again, wash my hands. My patient is safe. They tolerate the procedure well, and we maintain sterile technique throughout the whole procedure.